What's going on, guys? Caden here. I know it's been a little while, but I am 1 month post-op today, so I just want to do a quick video to kind of record what's going on with my healing process and what I'm able to do now. I just got back from the gym, so I have this obnoxiously large green shake, but I'm going to kind of show you what's up with my chest and everything, and then, yeah, just do a quick vlog for you guys. Here we go, 1 month post-op. Give you a close-up here. I do have my scar guard on, so if it's anything shiny or peely. But this was the old drain hole. It's closed up now. Same on the other side. They're just like very, very light scars that are vertical right there. And then aside from that, like all the scarring is still quite fresh. You can see a little bit of puckering along the incision towards the front. This side's a little flatter. But yeah, so nipples are healing well. I don't need to dress them anymore as of 2 days ago. This one does still have a stitch in there. I don't know if you can still see it, but that's the only stitch that's left. And then this, I can't tell if it's swelling yet or puckering from just where my bone is. But the surgeon said my rib still sticks out, or rib sticks out further on this side than it does on this side. So that's why you can see a little bit more of a dent right here. But so that's unflexed. This is flexed. It's like, but yeah. So basically, I wanted to just kind of get into what's been going on. So I am 4 weeks and 3 days into the recovery process, which is a total of 6 weeks. Technically, you're not supposed to be exercising until that 6-week mark, but you can elevate your heart rate after 3 weeks. So I kind of took that as I was going to start doing light cardio around 3 weeks, which is what I did. And I know I'm not supposed to be doing this, but I've actually started lifting a little bit. I do leg day every other day, and then I'm doing just bicep, tricep with a little bit of shoulders. Excuse me, shoulders, as long as I don't have to like reach too far. Range of motion is still, it's good. I just don't want to stretch the scars really that much. They might have stretched a little bit inevitably just because I have been working out, but I've decided that's kind of a risk that I'm willing to take at this point. I realized like during this recovery that how much I don't do, and how much like working out and stuff was pretty much the biggest time consumer I had. And some things have been going on with work and stuff with my job that I'm not really getting shifts anymore. I'm not really sure what the reason for that is. But so I haven't been working as much, so it's been a lot of time just kind of at home. And for somebody going through recovery and not having, their number one kind of hobby or thing that they do to stay busy, that's been really, really difficult and took a major, major toll on my mental health. So really I just kind of had to make a decision, whereas was it going to be my physical result that I was going to sacrifice in order to get my mental health back, or was I just going to, sit around and just kind of let it consume my brain? And I decided to, since I was past 3 weeks, I decided to kind of just start giving myself a little time in the gym to start feeling better, and it actually did help me a little bit. I started macro counting again. I'm doing all that because I did put a little weight around the midsection. It's kind of going away-ish, but I did put on a little bit, and that was kind of making me dysphoric, so I really needed to do something about it. So that's basically where I'm at. Started the macro counting and cardio, and then just got into lifting just arms, bicep, tricep, I should say. I'm going to try to hold off on chest, shoulders, and stuff for another week or two, just to kind of keep the scars where they're at, but they don't seem to be stretching too much or doing anything. Let's see, sleeping on my back is still annoying. You're really supposed to do it till 6 weeks, although I've woken up in the middle of the night several times and found myself on my side. which when you go to turn back onto your back, it kind of hurts. I don't know why sleeping on your side hurts, but it does. It doesn't feel good still at this point. So I'm trying to stop doing that. I don't really think it's having any like aesthetic consequences, but I'm not really sure. But yeah, I just wanted to kind of mention that as my one point in my 1 month post-op vlog is that the recovery process is really, really challenging if you don't have stuff to keep yourself busy, or stuff that's going to keep you busy enough to keep your mental health up. So that was one thing that I've really learned, and thankfully I'm towards the end of this recovery process now, almost 5 weeks. So I just wanted to share that with anyone getting ready to go through this, that make sure that you have adequate things to do and keep yourself busy. Otherwise, you're going to end up doing stuff too early like me. So that's pretty much where I'm at, but still really happy with the results, really happy with the healing. The only treatment I'm doing thus far is I'm doing coconut oil massages as many times as I can remember, minimum of twice a day, but try to do it around 4 times a day. And then I put my scar guard on twice a day if I remember, but 1 time if I don't remember the second time. So, yeah, that's the only treatment I'm doing now. Don't have to dress my nipples anymore, which is awesome. It feels really good just to like wear shirts with nothing under them. It's pretty awesome. And other than that, yeah, I'm really, really happy with how things are going. If anybody has any questions, feel free to reach out to me. Other than that, I'll see you for my 11-month video in a couple days.